good or as correctly as they should be. Sometimes that can lead to patient injuries, like injured shoulders and things like that, okay? Sometimes just grabbing underneath the axilla and grabbing underneath the other axilla, one person on each side, is counterproductive to at least one's biomechanics, and so you end up causing injuries. You can move from point A to point B with that, but it can cause injuries. So what we're doing is trying to put you in the most safest position and trying to put your patient in the most safest position. So we're going to show you one way. Is it going to help you in all situations that it involves a two-person lift? No, it won't, but it's a pretty good way. So essentially you're going to have one person at the head, one person at the foot, and I'll be asking for a couple of volunteers in just a minute. So this is manual, so it's going to require where the person needs about all your help. It's a dependent transfer, right? So they're dependent on two people to put them back, for example, into bed. So we use this as a bed simulator. Try and plan ahead so that when you actually do the transfer, put them back into bed, you don't put them back too far, okay? I guess if you have one of those sheets underneath them, then you could, you know, move them towards the foot of their bed. But nevertheless, it's always easier to reposition them if you have them too far towards the foot or either side where you could maybe have them, well, they're not going to be able to bridge and scoop because they're not going to be, but try and plan ahead so you can get them in a place where you want them to be placed. That will prevent further work after you get them in bed. All right. What else? The other thing is if you find yourself in a situation where a manual lift is not indicated, on October 11th we are having people come from our community and they are going to show some of the different technologies that can be used as safe patient transfers. One is as simple as a Hoyer lift. So you could be in a nursing home, hospital setting, and you're not comfortable transferring your person. In this case, you would use technology, which would be basically putting a sling underneath of them and then attaching that sling to literally almost something if you ever had to change the flat of your flat tire on your car, right? Literally, it's cranking this thing up and it lifts the person up once you get this sling underneath them. So you would have obviously access to technology. Now you could be in a home health care situation, right? Or some other situation where you just don't have that available, so you need to rely on still your manual skills. So let's see here. Would you mind being the patient, or I just want to start out, not that you're small, but start out smaller than someone like Andrew, us transferring him. I don't want anyone to get hurt, okay? Okay, come on. And then, who's feeling strong and mighty as a female right now?
I'll do it.
Will you? Now, I want to say this too. If anyone feels vulnerable, they're feeling today like they got a bad low back or something along those lines, disclose, because I'd rather not put you in a predicament where you're going to get hurt. This is the primary role of an OT. You're going to have to demonstrate sooner or later, but I don't want you to do it if for whatever reason just yesterday you were involved in something and you hurt yourself. So anyhow, Jillian's going to help us. Jillian, I'll put you in charge of the upper body, okay, and then I need someone to be in charge of the lower body. Go on. So, it kind of looks like this. Jillian is going to reach underneath the arms, okay? Go ahead and reach right underneath the arms. Good. Now what we're going to do is we're going to grab on the wrists. Perfect. All right. Then what we do is we just bring right the chest, cross it. There you go. Good. All right. Now, your head is always going to be on the same side that you're transferring, just like our regular transfers. Jillian is going to flex her knees and her hips with a broad base of support. Perfect. Left leg, I want you to open up so it's that. There you go. So now you got a little bit of a ways to move, so you're eliminating that twisting motion. Dan, you want to kind of get in here. Yep. Flexing the knees and the hips as straight a back as you can have, looking straight up. Just like we did this morning with spinal cord injury, try and get those larger joints and muscles working, so that those are the things that's going to lift the lower body. Not just the hands on the legs, get them in there and kind of support underneath. There you go. Now, Dan, you probably, you're going to want your head on that side as well. And if you can, maybe open up as best as you can. This is not perfect, but we are trying to put your body in the best advantage as possible. Typically what happens is the legs catch in between this person's legs and you still make the transfer. It's just not all that perfect of a transfer. Jillian is the leader, so that she's going to say 1, 2, 3. Once you hit 3, you both in unison make the transfer.
Okay.
The other thing is typically, obviously, when you're transferring, if you can have the surface that you're transferring to level with the chair or lower, that's going to be better, right? We can do that with the hospital beds in the nursing suite. Much more difficult when you got to actually lift the person up to a certain level, although sometimes that's the reality of things. Beds at home aren't always adjustable, so you might have to lift them up. Okay, I'm going to spot here, Caitlin and Jillian, on the count of 3. You're both going to move and take Caitlin to the mat.
1, 2, 3.
That's how it's done. Nice job. All right. Why don't we just get the 2 of you done and have you switch?